Good morning, everyone. Good morning to our Penn Adolescent and Young Adult Medicine patients and their families, to Perelman School of Medicine Dean Larry Jameson, University of Pennsylvania Health System CEO Kevin Mahoney, distinguished panelists, colleagues, and friends. Welcome to our program, COVID-19 and Gen Z, When Can I Get My Life Back? I am Dr. Janice Hillman, adolescent medicine specialist at Penn for 39 years. Our team founded Penn Adolescent 19 years ago in 2002. The practice was founded with the core beliefs that 1, teens are important, 2, teens are our future, and 3, teens would benefit from providers that are passionate and invested in their physical and emotional health and well-being. Welcome to our program. During the past 16 months, our young people have lived through this COVID-19 pandemic with unprecedented stress, loss, and isolation, especially during their critical developmental years. We worry what will happen to them short-term, long-term, physically, emotionally, financially, academically. We wanted our young people to speak to the experts directly and candidly, unfiltered, down low, the 411. So we went straight to the top. We are honored today to have Dr. Anthony S. Fauci, our nation's leading expert on COVID-19, as our speaker. Dean Larry Jameson will present the Penn Adolescent Award, Humanism in Medicine, to Dr. Fauci, followed by a Q&A. The second half of our program will feature a distinguished panel of Penn medicine experts in infectious disease, psychiatry, and adolescent medicine. Dr. P.J. Brennan, Dr. Cabrina Campbell, and Dr. Kenneth Ginsburg. We will now hear from University of Pennsylvania Health System CEO Kevin Mahoney.
Thank you, Dr. Hillman. I'm Kevin Mahoney, and I have the privilege of being the CEO of the University of Pennsylvania Health System. Today, Penn Medicine and our Adolescent and Young Adult Medicine program have the pleasure of honoring the incredible and life-saving leadership of Dr. Tony Fauci with our inaugural Humanism in Medicine Award. Throughout this pandemic, our country and my family turned to Dr. Fauci because of his commitment to science, facts, and truth. This is also a tremendous opportunity for our young guests to ask Dr. Fauci and the Penn medicine experts questions they want to know about life during and, more importantly, after the COVID-19 pandemic. Dr. Fauci, your guidance helped shape Penn Medicine's COVID-19 response, including the launch of Project Resurgence. When the pandemic started, for example, we were seeing 500 telemedicine visits a month. Now, we are seeing over 8,000 a day and more than 1 million since the beginning of the pandemic. We also moved much of our care to the home setting, and in fact, hospital at home is becoming a critical part of Penn Medicine's future infrastructure. We will also proudly open the Pavilion at HUP in October. This $1.5 billion state-of-the-art facility will further bring research and care closer together in the physical as well as collaborative sense. Continuing the construction during the pandemic was tricky as we focused not only on the usual making budget and keeping the schedule, but also on the safety of the construction crews and staff on site. In short, we had so many questions, and often my answer was, what would Tony do? Today, we're also so proud of the groundbreaking Penn science behind the COVID vaccines. We've administered more than 500,000 doses, but perhaps none as important as a day in December when our messenger RNA pioneers, Dr. Drew Weissman and Dr. Cataline Carocco, received their COVID-19 vaccines right here in the facility where the vaccines were enabled by their foundational research. As you may know, we also made news by announcing a mandatory vaccination policy for our health system employees. We hope that this national leadership position, coupled with our community outreach through numerous pop-up clinics throughout the region, will keep Philadelphia safe and prevent any future outbreaks. In short, thank you, Dr. Fauci, for your service to our country and the world during the pandemic. Now, I'd also like to take a moment and thank Dr. Hillman for spearheading and hosting this event. In her nearly 40 years of service, Dr. Hillman has helped transform the care of young adult patients across the Main Line, across the Delaware Valley, and the nation. In 2002, she founded the Center for Adolescent and Young Adult Medicine, a testament to her dedication and commitment to clinical excellence. Under Dr. Hillman's leadership, the center has quadrupled in size and has cared for nearly 250,000 young adults and counting. I also want to take a moment to extend my personal thanks to my friend, Dr. Janice Hillman. Over the past 25 years, no matter the time of day nor the day of the week, including vacations, Janice has always answered my calls for help with a patient. Janice, you have been my go-to physician long before there were top docs in Philly Magazine. You are truly remarkable, and I thank you for being my friend and a consummate physician. I would now like to introduce Dean Larry Jameson. Larry, I'd also like to take this moment to once again thank you for your unwavering leadership of Penn Medicine during the pandemic.
Good afternoon, everyone. I'm Larry Jameson, Dean of the Perelman School of Medicine at the University of Pennsylvania. For many of our young guests, this has been and may very well remain one of the most impactful events of your lives. I'm proud that our institution has joined other leading health systems at the forefront of this fight, and none of our collective efforts would have been possible without the formidable expertise, poised leadership, and absolute commitment to our nation's health, that of Anthony Fauci. Dr. Fauci has served at the NIH as director of the National Institute of Allergy and Infectious Diseases since 1984. There, he oversees an extensive portfolio of basic and applied research on infectious diseases, as well as supporting research on transplantation and immune-related illnesses. Dr. Fauci has advised 7 presidents on HIV/AIDS and many other health issues, both domestic and global. The key reason why we chose Dr. Fauci as the inaugural recipient of our Humanism in Medicine Award is that beyond his incredible scientific acumen and his personal research, he is well known for his compassion and commitment to health for all. On a personal level, I've worked with Dr. Fauci as a co-editor of Harrison's Principles of Internal Medicine for several decades, and I can testify to his breadth of interest, his breadth of knowledge, his commitment to ethics, and his commitment to compassion and humanism. Dr. Fauci, congratulations, and I hope you will feel free to share some of your wisdom with us, particularly the younger audience, as they continue to navigate this extraordinarily difficult time. We would welcome a few remarks.
Thank you so much, Dr. Jameson, for that very kind introduction, and thank you so much for this distinguished award from Penn Adolescent and Young Adult Medicine. I'm deeply honored to accept this tribute. It would be premature to declare victory, but America is extraordinarily fortunate to be emerging from the very darkest days of this historic COVID-19 pandemic. Through concerted efforts to vaccinate as many people as possible, as quickly as possible, we are thwarting the ability of SARS-CoV-2 to both thrive and mutate, driving down the average daily numbers of cases, hospitalizations, and deaths. This is how we will defeat this pandemic and restore our lives, each of us doing our part by getting vaccinated to protect ourselves, our loved ones, and our communities. Vaccination can relieve the worry about serious illness and death, but it is just part of reclaiming our lives. Many young people have been spared from COVID-19 illness, yet we know well that adolescents and young adults are among those who have been most deeply affected by this pandemic. overcoming the mental trauma caused by this pandemic, resulting from things such as disruptions in education, isolation from friends, grief, anxiety, and depression, is critically important. Recovering our mental health will be highly individual, and we all must be caring and patient in our expectations. Thank you again for honoring me with this award, and please keep up your outstanding work.
Well, thank you, Dr. Fauci. Certainly, this award is really well deserved. And now, Dr. Janice Hillman and I have some questions that have been submitted from our guests. So we'd like to have a brief back and forth interview with you. And so, Dr. Hillman, why don't I turn things over to you for the first question?
Dr. Fauci, we started COVID-19 vaccination in December 2020 for everyone 16 and older, and then started vaccinating young adults, teens, 12 and older in May of 2021. We have been reassured that the vaccines are safe and effective. We've been reassured that this mRNA technology is also safe and effective. However, I will tell you that parents still come up to us and saying, are you really sure? Are you really sure that that long term, I'm not going to regret that something happened that maybe I shouldn't have? How can we reassure them without years of experience?
Well, that's a very good question, Janice, and we shouldn't in any sense put down the reason why people ask that question, because they should not be blown off in any way. The fact is, if you look at the history of vaccinology, there's reactogenicity and then there's adverse events. People always are concerned about long term, measured in years. But in fact, in the history of vaccinology, that just doesn't occur. If you look at all of the adverse events, serious and otherwise, that have occurred secondary to vaccines, they almost invariably occur between 15 and 45 days following vaccination. And that's the reason one of the components of the emergency use authorization that you must wait at least 60 days from the time that one half of the people who've received it have received their last dose. Mm-hmm. So even the initiation of the emergency use authorization is well beyond 60 days. And right now, we are many months beyond the initiation of the EUA. So we feel really quite confident that if they exist at all, they're extraordinarily rare, even if they exist at all, right?
And I think as physicians, we know what extraordinarily rare means, which is very small, but not zero. And so it's still hard to reassure parents. They say, well, but we'll have to keep saying extraordinary low, but not zero. And I think that speaks to and acknowledges the small worry that's still there, but we do our best at making guidance and making protocols.
Yeah, Janice, the other thing that we should try and do, and we do, and I'm sure everyone who's involved in this understands that's when you bring in the issue of risk benefit. If you look at the risk of COVID-19 disease and the chance of even a young person, we know that the incidence of severe disease is much lower in younger individuals than the elderly and those with underlying conditions, but that certainly is not zero. In fact, it's overwhelmingly more likely than an adverse event in the long run. So the data are really very much in our favor. So you've got to let them understand that. People argue, well, people who are young, they generally don't get adverse events. But right now, if you look at it, and I know you're seeing that at Penn, you're seeing young individuals being admitted to the hospital, some requiring intensive care. We know when adolescents get admitted, 5% of them require intensive care. About a third of them, and 5% require mechanical and ventilation. That is serious. Even though the numbers are small, that risk is much worse than any possible risk of an adverse event.
You bring up a very good point about because COVID-19 disease in teenagers seems very different than COVID-19 disease in adults. So teens have less infectivity, less morbidity, less mortality, but now we're worried about the long-term problem, small but real, of multi-system inflammatory syndrome in children.
Right.
And then now we're reading about the Delta variant and how it has greater infectivity in teens. Tell us about that.
Yeah, well, the MSC, or the multi-inflammatory syndrome in children, we even see some in adults, but it's mostly in children, can be a very serious disease. There have been several thousand of those reported. Again, when you're dealing with millions of infections, that's still a relatively small number, but it can be really quite serious. So that's something we just cannot disregard. The variants are a really interesting issue, Janice. The variants clearly, particularly the B117, is more transmissible than the original wild type. And now the 617, or the Delta, which is a really interesting story with Delta, because that has now assumed dominance in the UK. They started off with dominance in the Alpha, which is the 117. Now 92% of the isolates in the UK are 617. In the United States, it's 9%. The good news about that is that we know now from studies that the vaccines that we are using work very well, 88% or so, against the 617. So if you want to stay safe from 617, please get vaccinated. That's the message that we tell people. If you're really worried about variants, if you're worried about wanting to get your life back, if you're worried about wanting to pull back on restrictions such as masks, get vaccinated.
Well, we've heard you the message, and the message is clear. And I have my Penn Medicine Get Vaccinated badge, which we wear very proudly. But on that same note, as we take a collective pause and know we're getting vaccinated, we're wearing our mask less often, and we're going to return to in-person school, how worried should we be about a surge in the fall, winter of 2021?
You know, Janice, that will be totally related to the number of vaccinations. If you have the overwhelming proportion of the population vaccinated, you will not have a surge, and that's it. So it's within our power to prevent a surge. I know people are always worried about a fall or a winter surge. Get your population vaccinated and you will not have a surge.
Okay. Are we looking to do vaccinations complementary with the annual flu vaccine in terms of boosters?
Well, we don't know exactly when we will need to give a boost, whether it's going to be after a year or 2 years or longer. Right now, we're doing studies to determine what the what the degree of boost you will get, either against wild type or against the variant specific. Mm-hmm. The two parameters that dictate when we'll be able to boost or should boost would be, one, the correlative immunity. If you have a certain level of antibody that you know is correlated with immunity, if it starts to trickle down below a certain critical cutoff, then you know you're close to needing a boost. Or if we start seeing more breakthrough infections among people who've been vaccinated. Right. Thus far, we seem to do fine, but we got to continue to follow it. And when we get to that critical point, then we talk about booster vaccinations.
My understanding is that right now, ages 12 to 17 can be vaccinated. What do you see the timeline for younger age groups as we get into the later summer and fall?
Larry, we're already doing the age and dose de-escalation studies with more than one of the vaccines. So we're going from 12 to 9, then 9 to 6, then 6 to 2, and then 6 months to 2 years. We've already started those studies. We project that by the time we get into the late fall to early winter, that by the end of the year, we will have enough information to vaccinate children of any age, and we likely will get to 12 to 9 sometime in the late fall.
Is there any idea about cross vaccines? So if you get an mRNA vaccine and then switching over to one of the other more traditional vaccines, adenovirus?
Those studies are being done right now. They're called mix and match studies, where we're taking, for example, vaccinating with Moderna and then following up either with a Moderna boost or a J&J boost, and vice versa.
Okay. All right. Whatever whatever happened to the AstraZeneca? Now, we've not heard much about that. What happened with the risk of clotting?
Well, what AstraZeneca has elected to do is that they are not going to go for an EUA. They are going to wait for a BLA to get all their data together. So we don't know yet what the full scope of their data are in the United States. There was an AstraZeneca study in the UK and in certain foreign countries, and there was an AstraZeneca study here. We're now waiting for them to put in the data for their BLA. So that's going to be a while before we see anything from them.
EUA is emergency use authorization. What is a BLA?
That's a biological license application. It's essentially a full approval. I'm sorry, I shouldn't play those word salad games, those alphabet games with you. Sorry.
Well, I didn't know, but I imagine our audience is very mixed in terms of its scientific acronyms. So thank you for that.
I'm just thinking about the risk equation that the two of you discussed earlier, the risk of getting COVID, the potential risk of a vaccine. And Dr. Fauci, it would be useful, I think, just to mention how many vaccines have been administered, and it'll give a sense of the complication rate in the context of that number of shots.
Yeah, about 300 million doses. So in the worldwide, it's been over a billion, 1.9 billion doses. So this vaccine, that's a very good question, Larry. Thank you for bringing it up. If you look at the quantity of it, remember right now, 51% of adults have been fully vaccinated, and 63 or 64% of adults have received at least one dose. So you are talking about not millions, tens and hundreds of millions of doses that have already been given. And that's the reason why when you look at a denominator like that, the adverse events associated with them are just minuscule in comparison to the benefit of the vaccine.
As you know, tomorrow we'll be observing Juneteenth in commemoration of the end of slavery in the United States. The COVID-19 pandemic has underscored the inequalities in our healthcare system, that those people of color, that those of lower socioeconomic status have had less access, greater morbidity, greater mortality. What can we do to help change this algorithm?
Well, there's the immediate, and then there's the long-range commitment. The immediate is to make sure there's equity in the availability of vaccines to demographic groups that generally don't have good access to care. And that's one of the real hallmarks of President Biden's implementation program. In fact, the first day that I met with him right after he was inaugurated, he told me and the medical team that equity has to be critical in what we do with vaccines, making sure that brown and black people have access as much as they possibly can in pharmacies and community vaccine centers, mobile units, all kinds of things. That's the immediate term. The long term is more complicated because the reason why African Americans particularly, but also Latinos, why they have a higher incidence of the comorbidities that lead to a more severe outcome, including diabetes, hypertension, obesity, chronic lung disease, chronic kidney disease. The reason for that are the social determinants of health that have actually been present from the beginning of their lives. Because children grow up in areas they don't have access to healthy food. Young people don't have access to medical care, so you don't pick up hypertension when they're young and they come in when they're in congestive heart failure or who have kidney disease. Those are the things that we're going to require a decades-long commitment to overcome that. Because quite frankly, though some people don't like to hear it, that is steeped in the results of racism that these individuals in this demographic group have experienced from the beginning of their lives and have been going on forever. That's going to take a long time to turn that around. But I hope that our experience about these disparities are going to trigger us to make a decade-long commitment to do that.
We all hope so. Dr. Fauci, in addition to being a physician scientist, administrator, in the face of the COVID-19 pandemic in the United States, you and your family have also experienced all of these stress and loss. Would you share with us any things that you've given you guidance to your own family during this time? Any silver linings to share?
Well, yeah, the silver lining is somebody that Larry knows well. And the silver lining is my wife, who is the most supportive individual that you could possibly imagine. She is the chair of the Department of Bioethics at the NIH, so she fully understands all of the important implications of what's going on. But yes, I mean, I think family support at a time when you are really put into a completely unprecedented situation. You know, I say this to young people, particularly at commencement addresses, that you used to be able to say, you know, by the way, I can remember that when I was in your shoes, when I was graduating. You can't put yourself in their shoes because they've been through something that none of us have been through, a complete disruption of your life. And that's when I think closeness of family and friends comes in. And that's the reason why I really like what's happening now. As more people get vaccinated, more people can start interacting in a social way, which is so important, particularly for the younger people and the children.
Dr. Fauci, as the dean of a medical school, one thing I've witnessed is an incredible upsurge in applications to medical school and also to other programs like public health, a strong interest in preventive medicine. Some people have called this the Fauci effect. I wonder if you have any insights into this renewed interest in science, medicine, and healthcare.
Well, I believe, Larry, that it really is the effect of how good our profession is. And if you look at the solution to the issue, the scientific solution has been what was just mentioned about the decades of investment in biomedical research that has brought us to the point where you can get a vaccine in 11 months as opposed to 7 years. But also the bravery and the incredible performance of our healthcare providers, from the nurses to the interns, the residents, the attendings, the intensive care group. I know you've experienced it in really real time and in the real world at Penn, but this has taken place at medical centers throughout the country. And our profession, particularly the people on the front line, are really the heroes and the heroines of all of this. And I think younger people see that and they say, if I want to do something with my life that's important, that has an impact, well, the case study is standing right in front of you, the COVID-19 pandemic, and what the medical profession, the public health profession, and the scientific profession have done. Extraordinary performance, something that the profession should be proud of.
Well, Dr. Hillman, I think that's a great place to close. Dr. Fauci, we're so grateful for your time, but especially your leadership. And speaking of bravery and taking on a challenge, we all remember this time last year when you were guiding us through the early stages of this pandemic. And now, as you said, a record production time for the rollout of the vaccines, which are truly changing the impact of this pandemic in areas where the vaccination has been able to get rolled out. So congratulations on this well-deserved award. Thanks for joining us. And Dr. Hillman, I turn it back to you for the next panel.
Thank you, Dr. Fauci and Dr. Jameson. We'll now present the second half of our program. I am honored to present our distinguished panel of Penn medicine experts. Dr. P.J. Brennan, Chief Medical Officer and Senior Vice President, University of Pennsylvania Health System and Professor of Infectious Disease. Dr. Cabrina Campbell, Professor of Psychiatry, Perelman School of Medicine. And Dr. Kenneth Ginsburg, Professor of Pediatrics and Adolescent Medicine, the Children's Hospital of Philadelphia, and Director of the Center for Parent and Teen Communication. Each panelist will first present their perspectives on COVID-19 and Gen Z. Gen Z are young people now ages 10 to 25 born in 96 to 2011. Millennials are 25 to 40. Gen Xers are 40 to 55. And us boomers are 55 to 75 plus. I will now turn it over to Dr. Brennan.
Thank you, Dr. Hillman. I want to make a few remarks about the state of the pandemic, the vaccine, and a condition known as Longhaul that I'd like you to be more aware of. Conditions in the United States are improving rapidly in the pandemic, but it's far from over. Cases in the community have fallen by more than 90% from the levels we saw in the winter and spring, but there's still many areas of the world in which SARS-CoV-2, the virus that causes COVID-19, is spreading rapidly, and access to vaccines in many of those areas lags far behind Western countries. As a result, the virus will continue to infect, replicate, and mutate. The mutant strains of the virus are our greatest concern now. Dr. Fauci addressed this. All the viruses that are circulating in our communities now are really variants, primarily the UK variant, but we've recently begun to identify the variant strain that first emerged in India, now known as the Delta variant. We've had 3 cases of the Delta variant in our region, but I expect more to follow. Where the variant emerges does not matter. If the virus is replicating, it will mutate. The mutations that have been creating the variants are occurring in the so-called spike protein of the virus. The spike is a molecule on the viral surface that it uses to bind and enter human cells. The mutations in the virus's genome make the virus more fit as a human pathogen by permitting it to more avidly bind to human cells and thus making it easier to enter those cells, replicate, and cause disease. So persons in the Gen Z age range are vulnerable to the virus. About 15% of cases have occurred of the cases in the United States have occurred in this age range, most of those between the age of 10 and 19. Now, one of the concerns for younger persons with COVID-19 is the occurrence of the so-called long haul. So what is long haul? Most cases of COVID last for about 2 weeks with mild to moderate symptoms. Some, however, will experience lingering problems with their health. The long-term symptoms are commonly referred to as post-COVID syndrome, long COVID, or long-term COVID. The symptoms persist after the virus has been cleared from the body, but the condition can be quite disabling. Long haul occurs in children and teens as well as adults. And according to the CDC, the most common long-lasting symptoms are fatigue, shortness of breath, cough, joint pain, and chest pain. Other symptoms can occur as well. And loss of taste and smell, which is very common in the acute phase of the illness, can be part of the long haul as well. It's not really clear why some people have long-term COVID symptoms. We know certain risk factors put people at risk for more severe disease. These include high blood pressure, smoking, diabetes, and obesity, but there's not a clear link between these risk factors and persistence of symptoms. The virus can attack many different organs, and persistence of symptoms may be due to an inflammatory response, persistent organ damage, an autoimmune reaction attacking organs, or another as yet unknown cause. What is very curious is that it is not only those most severely affected by the virus who develop long haul. Those with milder forms of illness, and sometimes even those who are relatively asymptomatic, have persistent issues. Heart inflammation is a particular concern. An athlete should have a cardiac evaluation before returning to competition. How long the symptoms may last is unknown. If you had long haul COVID symptoms, you should see your doctor. Physical therapy can be helpful for the fatigue and body ache. So against this backdrop, it makes great sense to get the vaccine when it is available to you. That's the best way to prevent both acute COVID-19 disease and the long haul post-acute syndrome. Persons with immunosuppression can take the vaccine. Vaccinated parents are unlikely to shed virus and spread it to their children. The few people who do get COVID after having been vaccinated are unlikely. We know this, they are unlikely to be shedding virus. So there are many reasons why it's important to get the virus. In addition to which, I think, it's likely that we will have a small resurgence of the virus in the fall as we come back together and get back into schools. I don't think it will be as significant as we've seen in the spring, and certainly not as much as we saw in the winter. So thank you. I'll be happy to take questions later. Thank you, Dr. Hillman.
Okay, thank you. I'll now turn it over to Dr. Karina Campbell, Professor of Psychiatry.
I am delighted to take part in this presentation with the distinguished Dr. Fauci and my Penn colleagues. Thank you, Dr. Hillman. We have just been through the worst pandemic any of us have experienced, and there is no doubt that Gen Z is affected. Threats to mental health and COVID-19 are below. Next slide. Social distancing creates distance learning and a lack of peer support. It is challenging to be home with many distractions, which requires you to put in more effort to focus, concentrate, and remember instructions. Next slide. Everybody gets anxious, but we do not usually have constant worry about safety of our parents, grandparents, and who will take care of us. School refusal is a classic example of anxiety, but underlying this behavior is avoidance, something that we don't want to face. This can apply to not wanting to do any activity. Avoidance may feel good in the short term, but causes long-term stress. When we are stressed, our heart races, our minds go into a loop of questions. Why is my heart pounding? Am I going crazy? Am I dying? It is really scary and distressing. This is why an effective way to deal with anxiety is breathing exercises, because as we slow our breathing, it physiologically slows our heart rate and prevents the cycle of anxiety and puts you back in control. When you're anxious, you are often somewhat depressed and vice versa. Since depression is common, every medical student knows at least one Latin word and its meaning. That word is sig, which is Latin for prescribe. The mnemonic is, if you are depressed, you want to prescribe energy caps. The first S is for sleep. Sleep is important to well-being and functioning. I is decreased in interest of pleasurable activities. G is for guilt or feeling worthless. Pay particular attention to negative self-talk and other statements such as, I'm a loser. Decrease in energy and concentration can lead to decline in school performance. Let's focus a moment on suicide. Suicidal thoughts requires action. Kids as young as 8 to 10 years old talk about suicide. It is important to repeat and incorporate this phrase. Suicide is a permanent solution to a temporary problem. If you have thoughts of wishing you were dead, that the world would be better off without you, you may need to be evaluated by a mental health specialist. If you have intention to act on harming yourself with a plan, you need to be seen right away in the emergency department. Next slide. A child who is anxious or depressed cannot learn. Schools will need to help with reintegration and will need to set aside time to reconnect. One consequence of COVID-19 is post-traumatic stress disorder, which is defined below. Gen Zs who have been exposed to unexpected death or threat of death and then not able to gather and grieve a loss are at particular risk. You may have nightmares, feel guilty, become jumpy and irritable, which can lead to unhealthy coping, such as using substances. If these symptoms last more than 1 month, promptly seek effective treatment from your mental health provider. Next slide. How do we bounce back? Sometimes children don't just bounce back. We have to help them through the process of identifying and understanding their emotions. Next slide. When my Gen Z was able to be vaccinated, I was relieved. It is important to note we're all in this together. Helping others gives us purpose. Donating groceries is something Gen Zs of any age can do. This pandemic has shown the remarkable inequity for American citizens who lack ready access to care and basic necessities. Parents, what can you do? Help your child regulate emotions. Being calm when your child is not is a practice art of effectiveness. Have regular family check-ins and always start with validating your Gen Z's feelings, such as, it is hard missing out on all of these many activities. Listen to what your child knows about COVID-19 and correct misinformation. But since change is certain, every adverse event is an opportunity to learn flexibility and to adapt. Make a point of expressing confidence in their abilities of what they can do, rather than focus on what they can't. Thank you.
Thank you, Dr. Campbell. We now turn it over to Dr. Kenneth Ginsburg.
Thank you, Dr. Hillman. I believe that we have in place the seeds of the greatest generation in a century. You see, every generation is going to be shaped by the major events that they share during their adolescent years. It changes how they see the world, how they're going to parent, and even how they're going to grandparent. You know, today we're focusing on COVID, the germ, but let's be clear, so much more has happened in the last couple of years. We weren't just exposed to a germ. We were exposed to a germ that exposed us to the extent to which inequities make people more vulnerable. Issues around equity and social justice came to the forefront. For too many people, this was an awakening, but for so many people, this was just an affirmation of the reality that they lived by on a daily basis. This can be a turning point for humanity. And I believe it's you, Gen Z, who's going to lead us into a better shared future. Precisely because of what you've seen, you're going to create the solutions. You're going to be the generation that will not tolerate inequity and injustice. Above all, you're the generation that had to experience separation and isolation. You're the generation that really grew to understand that we are social beings, and without our support systems, our emotional health is challenged. Precisely because these feelings of isolation created so much stress for so many of you, yours can be the generation that turns the page on the shame and stigma that for too long has been associated with mental health. In sharp contrast, we have to elevate, we have to celebrate emotions. We have to recognize that the people who feel fully are precisely those who are going to make the best parents and colleagues and friends, spouses and lovers. We have to wear our emotions with pride, but learn how to manage them. We must never again deny our feelings or set them aside, believing that this is in service to some false notion of strength. Instead, we have to understand that we deserve to feel better and that it's an act of strength to reach out to other human beings. Precisely because you've experienced isolation, I believe you will be the generation who will lead us into the future fully committed to the power and the primacy of human connection. Because human connection can both solve problems on a grand scale and strengthen each of us as individuals. You know, when we navigate the world alone, we're like a stick that's fragile, that can easily be hurt or demolished with a gust. But when we join with even just one other person, one other stick, we become nearly unbendable. And when we join as a group, as a bundle of sticks, we become unbreakable for a reason that has something to do with physics and everything to do with spirituality. Together, we are more powerful than the sum of our individual parts. If that is the lesson that you draw, if you draw the lesson that says, I couldn't hug my grandmother for a year, you know what I'm going to commit to? Celebrating and venerating the elderly. If you are the generation that moves forward and understands that we will join together as humanity together, and I at any moment can be vulnerable, but will gain strength by joining with the person next to me, because in turn, I know that it's only a matter of time before I will lend my strength to someone else. As Dr. Campbell said, yours is the generation that can find a sense of meaning and an absolute purpose in healing humanity through the power of human connection.
Wow, that was great. Thank you all three for wonderful perspectives from your respective disciplines. We're now going to take questions from our teens directly, and starting again with Dr. Brennan, we have a question from Leo.
Hi, my name's Leo. I'm 17. I have friends who worry about the long-term effects of the vaccine and have not gotten it. Should I worry about that? I also wonder if I'll need a booster vaccine, and what about the variants? I've also heard of something called multi-system inflammatory syndrome that's serious and affects kids. What is that?
Thanks, Leo. Appreciate that question. The vaccine component, the components that make up the vaccine really are in the body for a very short period of time before they begin to stimulate the production of parts of the virus that stimulates our immune system and creates our immunity. The vaccine components do not alter our DNA. We've now administered more than 2 billion doses of the vaccine worldwide, and they're very safe. We know a lot about the vaccines and the way they behave because they've been around for 15 years. The technology has been around and has been studied for 15 years. And so there are no indications from the type of technology, the mechanisms of the vaccines, or the results that we've seen from the studies and since the release of the vaccines that there are likely to be long-term effects. The acute and long-term risks of COVID are much greater than any risk of the vaccine. I just want to say something about the inflammatory response too that is seen after COVID. So the MIS-C, the multi-system inflammatory syndrome in children, it also occurs in adults, by the way, is a condition where different parts of the body become inflamed. Inflammation is a process of the immune system that fends off infections and things that are foreign to the body and enter it. But sometimes that inflammation can be directed against the body itself. And when it is, organs such as the heart, lungs, kidney, brain, skin, eyes, and gastrointestinal tract can become inflamed and damaged. This is a complication associated with COVID-19 infection. The illness presents as fever and a variety of other symptoms depending on where the inflammation is occurring, but oftentimes there's abdominal pain and vomiting and diarrhea. As I said, it can occur in adults as well, but it occurs more often in children. It's not common, but it's an important and serious complication. And again, the vaccine is the best way to avoid having this happen.
Yeah. PJ, I have two questions. So one, we talked about immunosuppressed patients who can receive the vaccine safely. Mm-hmm. Immunosuppression can range from prednisone for asthma to biological immunomodulators. Can we lump the two together?
Well, there are different components to immunity, and congenital immunodeficiency syndromes may be impairing immunity in different ways than pharmacological agents or drugs. But the point here is that there is no contraindication based on immunosuppression to receiving the vaccine. You can get the vaccine. The question is whether you can respond. So, we do know that in some instances, people who have been vaccinated while they were immunosuppressed have not had a good response, and some have gotten COVID-19. But there's no contraindication to do it. I would take the vaccine if I were immunosuppressed, and hope that there's a good response. It may be necessary to take other precautions, sort of belts and suspenders, to be safe. Yeah.
We've got lots of questions in our chat box. I'm going to try to we have over 100 questions, but pregnancy and breastfeeding, safe for the vaccination?
Yeah, pregnancy and breastfeeding the same. There have now been studies released showing thousands of women, tens of thousands of women actually have taken the vaccine. COVID-19 is a serious problem in pregnancy. Women who have COVID-19 in pregnancy have worse outcomes than women who do not have COVID-19. So it's important to be vaccinated, and the professional societies, the obstetricians are recommending vaccination during pregnancy.
Okay, thank you. We're now going to have a question for Dr. Campbell from Patrick.
After a year of losing sports, activities, and school, many of us are feeling depressed and anxious. What do you think we can do to help us move forward? Do you think it will happen again?
Excellent questions, Patrick. Do I think this will happen again? I think we are still in it, though moving in the right direction, as long as we continue to vaccinate more and more people. It is normal to feel anxious and have temporary blues. Unfortunately, for some, mental health problems will last longer than the pandemic, and getting help is now more available with face-to-face visits or telepsychiatry. In order to move forward, sometimes we have to slow down. We don't have to be pressured to catch up all at once. Being excited as you are about school, sports, and activities are key ingredients to good mental health. Getting back to school and sports will happen. It is a matter of when, which depends on how determined we are to be vaccinated and to take control of our own mental and physical health. And the good news, Patrick, plans for lifting restrictions are already happening. Thank you.
Karina, quick question. PTSD, do we see that happening soon after the exposure, or can we expect to see it months down the road?
That is such an excellent question. In fact, the it's such a point of the fact that PTSD, by definition, is not diagnosed until you've had more than a month of symptoms. But sometimes PTSD is actually delayed, and there's an actual delayed onset of PTSD. So it'll be very important for us to be vigilant to make sure that our Gen Zs are doing well, functioning well during the pandemic, right after the pandemic, and then even down the line, because yes, PTSD can have a delayed onset.
All right, we now have a question for Dr. Ginsburg from Sydney Brown.
Hi, I'm Sydney Brown, the Youth Poet Laureate of Philadelphia. I've been a fully virtual student since March of 2020. How do I feel more comfortable coming back to school in the fall? And how do I tell my friends to respect COVID guidelines without sounding too cautious?
Thank you, Sydney. Your question itself demonstrates your thoughtfulness, your open-mindedness, and your willingness to learn. When you do go back to school, take pride in the fact that you're paying attention. You're listening to the science and you're thinking about safety. And I don't want you to worry about seeming too cautious. Speak the truth, right? This isn't just about you. It's about protecting the people who surround you, your loved ones, the vulnerable in your communities. There's so many things that I love about adolescence, but at the top of the list is your idealism and your desire to build a better world and to protect the people who are around you. There's no reason for you to frame this or apologetically for being meek or being cautious. You are being strong. You're equipped with the knowledge that you sought out. You're being strong because you choose to protect other people around you. Your caution isn't out of fear. It's out of a desire to protect others, to care for and about the people who surround you. Go back and wear that with pride.
That brings a point where people are saying, well, kids don't get that sick from COVID. Why should they get the vaccine? But what they're doing is protecting others, protecting all the other populations who either can't get the vaccine because they're under 12 or are older people from transmitting it. We're now leave it open to questions from the chat box, of which, again, there are over 100 questions. Dr. Brennan, speak to again when kids under 12 can expect to receive the vaccine.
Well, the studies are ongoing, and as Dr. Fauci described in his comments, we're working our way down from the 12 to 17-year-old age group to 9 to 12 and then 6 to 9. I expect that perhaps by the fall, but certainly in the fall, and at the latest by the beginning of the second semester of the school year next year, I believe we'll have approval for at least some of those age groups. So we're moving in the right direction, and I expect we're going to get there pretty quickly.
And then to Dr. Campbell, Dr. Ginsburg, mask wearing has been something that we're used to, but could it be that the mask wearing becomes not only a positive symbol, but a negative symbol? That we're afraid to see a mask, or I feel reassured still wearing it in certain situations.
Well, let me just start by saying that even though Gen Zs are less susceptible to the physical problems of COVID-19 and contracting it, when Gen Zs contract COVID-19, their mental health is much worse. So wearing a mask is a very smart idea. And it is a real reassurance that you are protecting yourself and you're protecting others around you. So I think that as long as someone is not vaccinated, that wearing a mask, as Dr. Ginsburg said, is not only helpful for yourself, but certainly helpful for everybody around you, because we are all interconnected.
I would like to ask my panelists if they have any closing comments to share.
Well, Dr. Hillman, I just want to follow up on Dr. Campbell's comments. Everyone should feel comfortable in wearing a mask. We don't want to see people bullied in school or challenged in public because they're still wearing a mask. There may be any number of reasons why it's important for a person to wear a mask, from immunodeficiency to just their inability to receive the vaccine, for example. So you should feel comfortable continuing to wear a mask. Just because masking mandates have been lifted, it's still optional. You can still do it. And there've been other benefits. We've seen no influenza this year.
So thank you for that, because I'm feeling the sense that the mask has become almost like a political symbol of where you stand. But I believe that the most important thing we can do for our kids is about safety. And the mask, to me, represents safety. It's not any political statement. It's about protecting myself and others.
That's right.
And I do feel safer. And which brings to the question to the panel about, I totally appreciate why we now are releasing some of our restrictions on social distancing, mask wearing. We're taking down our plexiglass barriers in our office. And there was a moment I said, oh, it feels a little premature to do that. Why not? It's not causing any hazard, the plastic shield. Any comments about that?
Well, if you're vaccinated, you're in a very safe situation. The vaccines really work. Doesn't mean you won't get infected. Some people do. The vaccines are not 100% infected. But even if you get infected, you're not going to have a serious illness. So, that's first and foremost. But if you're in an uncomfortable situation, if you're in a large crowd, if you're in an NBA arena, with 20,000 of your best friends, you might want to continue to wear a mask. And I'm seriously considering masking next flu season, frankly, because I don't like getting the flu, even though I get the flu vaccine every year. So, I would continue to do that.
Oh, that's good to hear.
I wanted to say, wear your mask with pride. If you want to put some bling on your mask, go right ahead. I certainly wear my Penn Medicine or University of Penn, Pennsylvania mask with a lot of pride. And I think it is so important that we collectively, as has been said before, take care of each other. And that's really one of the ways that we can do that.
Janice, you asked about when things are going back to normal, and you brought up plexiglass. And I am literally stopped on the streets to ask when things are going to go back to normal, because they want the resilience guy to say, oh, everybody's going to be fine. People are going to bounce back. They're going to be resilient. And what I say is actually, I hope not. There's a lot of lessons to be learned from this time around equity and justice, but also about how we live our lives. We've always been juggling a couple of balls, and now we've had a fourth, fifth, sixth, seventh ball juggling. And as a result, the most competent people in the world are dropping some balls. This is a moment to look in two directions. Up, which balls are staying in the air? Which ones are up there? Now you know your priorities. And I think it's going to be about safety, about family, about taking care of each other. Now look down. And there are some balls that are on the ground. And if you want to move forward with more resilience and be able to find more time and energy to work on what matters, choose to leave some of those balls on the ground. That's going to enable us to have longer term mental health.
Thank you for that wonderful image of the balls in the air and the ones on the ground. I will take that image. Thank you. So
and we want to build back better. As our current occupant of the White House says, and it is very important that the fact that Gen Z is so diverse, that they will bring us a lot of different perspectives of how to build back better. And I'm really excited about this next generation coming into its own, because again, every adversity gives us an opportunity for resilience.
Oh gosh, thank you all so much for this great discussion. We have much to learn and many, many questions that have come up, which we'll all try to answer. So I thank you to Dr. Fauci, Dr. Jameson, Kevin Mahoney, Dr. Brennan, Dr. Campbell, Dr. Ginsburg. I thank you to my team at Penn Adolescent Young Adult Medicine. Thank you to Penn Development. Thank you to my daughters, Dr. Jennifer Blakemore, and Abby Hillman, to my family and friends. And most importantly, I thank you to the amazing teens and young adults for their courage and their resilience during these difficult times. I learned a lot during this program, and I hope you all did too. In closing, I want to make sure that if anybody has an emergency or urgent crisis, to please call 911 or go to your local closest emergency room. Please feel free to contact us at adolescentmedadmin@penmedicine.upenn.edu. Thank you all for attending our program. Let's continue to work together. Let's keep those balls in the air and keep those balls on the ground. Be well, be safe. Remember, it takes a village to raise a child. Thank you very much.